Hello, I'm Dr. Joel Amidon, the Chief Medical Officer here at Nescentia, and today we're going to discuss advanced care planning. Advanced care planning is a very important part of providing complete and comprehensive care, especially for members with advanced age and medical issues, and it is in keeping with our efforts and goals here at Nescentia. As the Chief Medical Officer, I see our goals of care are to 1. Optimize the life experience of our members within the confines of their health, social, and living parameters. 2. Advance care and services to ensure the best quality of life and prevent pain and suffering whenever possible. 3. Provide members access to information and knowledge regarding medical and social issues, including end-of-life care, and when appropriate, to support our members and their family in making thoughtful and difficult decisions. 4. Providing the opportunity for our members to express their wishes for the level of services they want and expect, and then provide and promote care that complies with their wishes whenever possible, especially for end-of-life care. I've heard that advanced care planning is considered a type of preventative medicine that, like most preventative medical practices, is underutilized. Because our members and applicants are at high risk for progressive medical and social issues, we would like to address advanced care planning early on. The initial conversation may be only to inform the member that 1. There is advanced care planning, 2. The types of issues that it can address, and 3. How the process may progress. Advanced care planning is an individualized process. Advanced care planning may include healthcare proxy determination, documentation of expressed and undocumented wishes for any aspect of care, social worker intervention to provide greater information, guide the member, and formalize wishes through available documentation such as a healthcare proxy or a MOLST form. MOLST is Medical Order for Life-Sustaining Treatment. Then complete the healthcare proxy and MOLST form. We can also refer the member to the primary care physician or specialty clinician for further guidance of medical issues, and we can refer to legal representatives for guidance about power of attorney, trusts, or other legal issues. We must acknowledge that members who have medical issues and possibly be nearing the end of life may want their care to focus on the quality of life and comfort and not on longevity and more medical intervention that may take them away from their home and families for prolonged hospitalizations, poorly tolerated treatments, especially when the long-term prognosis is limited or poor. The decision to limit or even completely refuse medical care is difficult, as a hope for future cures and good outcomes is often falsely predicted and expected based on our beliefs from television shows and the report of someone else's outcome. That's why so many people play the lottery. Their chance of winning is exceedingly low, approaching nil, yet millions of dollars are spent on that hope and a dream. Advanced care planning provides the individual with the opportunity to preserve their right to self-determination when it comes to their health care and who will decide. In a landmark case regarding a patient's rights, Justice Sandra Day O'Connor stated, "The liberty guaranteed by the 14th Amendment must be protected. If it protects anything, an individual's deeply personal decision to reject medical treatment, including artificial delivery of food and water." By educating the members about their clinical issues, treatment options, and the benefits and burdens of such, the member can effectively exercise their wishes for care. If the member does not participate in completing their advanced care planning, they may lose their opportunity to express their wishes and beliefs and direct their care. I've been a family practitioner for 36 years, and in the first 10 years of my practice, I would do hospital rounds in the early hours of the morning. That time period has the most frequent codes being called. Whether it is due to the adrenal surge in the morning or the rounding nurse finding a patient unresponsive, the fact remained. If the individual who coded did not have documentation of an advanced directive limiting heroic measures, they were provided aggressive resuscitative measures despite the likelihood of limited or no benefit at all. Advanced life support protocols were followed. A sad experience I had was assisting with resuscitation on a 104-year-old patient because the physician and the family were, quote, not ready to discuss her medical issues and prognosis. Needless to say, the code did not prolong her life, but actually traumatized her for the last 30 minutes of her existence on earth. I found it inappropriate that the physician and the family members could not or would not address the reality of her 104-year-old status, medical issues that put her in the hospital, and the likelihood of benefit from cardiopulmonary resuscitation being low. It is my belief that every person has the right to whatever care they want if they are educated on the potential for benefit versus futility and negative effects of treatment. I myself would prefer to spend my final days watching the sunrise and the sunset from my home rather than looking at a monitor in the ICU where everybody knows the prognosis is poor but refuses to or is not allowed to address the reality and futility of the situation. Advanced care planning and completion of advanced directives allows a person to pick a healthcare proxy who they can trust to promote their wishes when they cannot speak for themselves. A most form or a living will provides an avenue for the patient to profess their wishes when they cannot speak for themselves. Hopefully, when the patient completes their advanced directives, they are educated on their prognosis and the likelihood of benefit from resuscitative measures versus the potential for unwanted procedures, prolonged hospitalization, and the potential for long periods on artificial life support. Furthermore, advanced directives can be modified by the patient or their healthcare agent if the prognosis changes, either way, for better or for worse. Whatever advanced directive a patient decides upon is okay. The patients that don't decide leave the decision to their family and or loved one, which may not accurately represent their true wishes. Advanced care planning is the opportunity for one to express their wishes and pick a spokesperson who will represent their best interests when they cannot. I feel strongly that we must educate our members about the opportunity to express their beliefs and wishes before it is too late. Although no one can predict the future, the educated member's guidance is usually accurate and the best. Some issues can arise with our current system include: 1. Members do not address advanced care planning prior to a sentinel event. Then in the confusion and stressful time of an acute event, a decision is more difficult to make, and often no decision is made. No decision is a decision in itself. Everything will be done often with limited regard to benefit, suffering, death without dignity, and both medical insurance resources consumed. 2. Advanced directives may not be honored by the healthcare proxy or healthcare agent. The person designated to enforce the member's wishes can change a palliative or comfort care directive in favor of hospitalization and all that goes with it, including feeding tubes, dialysis, invasive medical procedures, and whatnot, rather than allow the individual to pass it home with friends and family and a death with dignity, peace, and comfort. 3. Members admitted to the hospital or held in the emergency room are often not offered advanced care planning education prior to what may be futile testing and procedures. Is there a financial disincentive to promote palliative or comfort measures for those with poor prognosis when expensive and lucrative procedures are to be eliminated? And 4. Society has a perception that palliative and or comfort measures equate to a death squad. This perception fails to acknowledge that some medical procedures, especially in members with advanced age and or advanced disease processes, may increase the risk for morbidity and mortality. The quality of the individual's remaining days may be sacrificed for the promise of a longer life, but at what price? Remember, there are no guarantees. Studies show that discrepancies between a member's wishes and the medical treatment given decreases if advanced care planning is addressed early on and periodic review and discussion between the stakeholders, confirming and modifying the member's advanced directives when appropriate, are done. Members and families have the right and power to determine their future when it comes to end-of-life care. Do not squander the opportunity to decide how your future will play out. So what would we like you to do as a provider for Nescentia? 1. Be alert for members who have not addressed advanced care planning. 2. Notify the appropriate manager to follow up with a member if they express a need or a desire to address this issue, if they had a change in clinical or social condition and their current advanced directives need to be reevaluated, such as a change in healthcare proxy or healthcare agent, or an update of a MOLST or a living will. 3. Listen to members and or their healthcare agents for indications that they need counseling on prognosis, palliative or comfort care, concerns about their current living situation, and the possible need for a change in their level of care. To optimize the care for our members, you must be the eyes and ears that will identify a need or a change in need. You must feel comfortable that you can relay the information onto the appropriate supervisor or team member, and that the situation will be investigated and appropriate change pursued. We at Nescentia have skilled clinicians and social workers that can assist with this process. As the Chief Medical Officer for Nescentia, I want to thank you for the services that you provide and encourage you to notify the appropriate manager or me should you have a medical question or issue that needs to be addressed.